Hi, my name is Dr. Danielle Crane. I'm a clinical psychologist, and today we'll be answering some of your questions. So the first question I have is, what is the worst part of your job? I mean, there are lots of parts that are difficult. Generally, I've worked with people who have a very high risk presentation where there's always the chance that they could very seriously harm themselves. And it's very difficult carrying that responsibility, and it's difficult obviously also when things go wrong. I have had times where I've been on call in an evening and I've had someone phone to say, they're very distressed and they're on the edge of a bridge and then hang up. And so I've then had to spend the evening contacting emergency services and that's the thing, to try and ensure that that person is safe and is cared for. So it can be very challenging in that way. I think another thing that's very difficult about the role is obviously within NHS there is a lack of resources. Sometimes you can have the very best intentions and be trying to provide the best possible service, but there's not enough staff or there's not enough time, and that's the thing which can be very disheartening and demoralising for staff, and also very difficult for clients themselves. So I think that's something that I'm sure most NHS staff would mention. The other thing is sometimes people can be really desperate for help and really want help, and at the same time have mixed feelings or ambivalence or defences that kind of block them from accepting that help, to the point where we can be trying to support the person, trying to help them, and they can end up kind of having that sort of push-pull dynamic where they are wanting help and they're pushing you away at the same time. And there are so many different reasons why that can happen. They might have had difficult experiences with previous professionals. It might be that it's an attachment style as a result of the way that they were raised. It might be that they're having paranoid thinking and they're being told not to engage with us, or that making changes is just really, really difficult for them. Can end up with that sense of feeling a bit stuck, which I'm sure is how the client feels as well. And so, it's really important to acknowledge that, both with the client and with your supervisor, and that's the thing, and adjust your approach if needed. Talk with them about what is it that's getting in the way, maybe use things like motivational interviewing techniques if needed. So we do really have to tailor things to the individual in those instances. So those are probably the three things that I tend to find most difficult. I'm sure I've forgotten many other things. It is a challenging role. At the same time, it is really rewarding, when you do see people who manage to kind of overcome those difficulties or get to the point where actually they feel like their life is, worth living, and that's the thing, it makes all the other things worth it. So our next question is about confidentiality. So this person was concerned about government being able to request access to your case notes, and that's the thing. So we do provide a confidential service. We only share your information with people who are actively involved in your care. There are some exceptions and limitations to that. So if we feel that you are at immediate risk of harm or someone else at immediate risk of harm, we do have a duty of care where we would have to break confidentiality and speak with other services in order to keep you or the other person safe. We would normally try and have that conversation with you before we speak with them, as much as possible. There are other exceptions. So for example, if we receive a court order stating that we have to hand over case notes or information about you, then we are legally obliged to. However, we are often allowed to go through the notes and redact anything that we feel would cause you or someone else harm. So for example, if you've spoken about someone else as part of your therapy session and it's bits of their personal information, we are allowed to kind of remove that. And that's the thing. So we are very careful, when going through those notes to make sure that we are only sharing things that are relevant and things that aren't going to be harmful to you. And actually, a lot of the time, clients are keen for those notes to be shared because the notes actually help support their case. There was mention in this person's question about being sort of an anti-vaxxer, and actually that wouldn't be a valid reason for us to hand over your case notes to anyone, because it's not, no one's at immediate risk of harm and it's not a court order. So I wouldn't worry about that aspect in particular. So I hope that's helped a bit. If you do have further concerns about confidentiality, then please do send other questions or speak with your therapist themselves, and we'll do our best to reassure you and explain how that works. So our next question was about wanting an overview of acceptance and commitment therapy. So I will record some much more detailed videos in future about this, but in general, acceptance and commitment therapy is referred to as ACT. It's an approach where you are taught how to accept your thoughts, feelings, and previous experiences, because constantly fighting against them tends to actually just lead to further suffering. And by accept them, I don't mean approve of them or like them in any way. I just mean acknowledge the facts of reality, acknowledge that they are there, to be able to notice them and not have to engage with them, not have to push them away, all that sort of thing. It can make a huge difference in people's lives. And the approach also teaches people how to adjust their behaviour so it's more in line with their values, so that they can actually live a meaningful and fulfilling life. It's an approach that we can deliver in groups or individually. The sessions tend to range from 6 sessions to 20 sessions. It's something that can be really useful for a very wide range of difficulties, including depression, anxiety, chronic illness, and grief, trauma. So it's something that's worth looking into if you're interested in that approach. And there's a whole range of different skills, including mindfulness and cognitive diffusion, and that's the thing that I'll make some videos about in future. But I hope that's provided a little bit of an overview just to start with. Our next question is, can all psychologists diagnose autism? And the answer is no. So most psychologists will have a good understanding of autism, be able to notice signs of it and be able to tailor your therapy to your needs. However, not all psychologists can complete the full autism assessment, and that's because it requires specialist training. A lot of people use one called the ADOS, but there are also other versions, and it requires having a session with you and your family to gather developmental history about sort of your early childhood, and then an assessment where they will ask you lots of questions or ask you to complete tasks, and then the therapist will then write all of that up in a very detailed report, and have a session with you to kind of explain the outcome of that assessment and what it means, what things you struggle with, what things you're really good at. So it is a very detailed process and it does require specialist training. If it's something that you're wanting to have, then I recommend talking with the therapist or the service that you're currently with to find out if it's something that they can provide, or if not, if there are other services or therapists that they can recommend. There is also something called the right to choose process that you can sometimes use if there is a long waiting list for autism assessments in your area. And I can post a link to that below with some more information about it. So those are all the questions from this week. Do feel free to comment or send a message if you have anything that you would like me to try and answer in the next video. Thank you.